The health minister made this disclosure recently while addressing sources of health professionals at the opening of the neonatal conference at the Arthur Chong Conference Center, Lillian-Dahl, Greater Georgetown. The 150-year-old National Psychiatric Hospital at the East Quarantine Berbice, he noted, would eventually be shut down and plans would be made for the mentally ill to be accommodated at a new hospital that would be built in that same region.
We have a section for psychiatric patients. Based on the new legislation that we've passed last year, we no longer want to keep psychiatric patients for long periods in institution. The new way of treating psychiatric patients is when they have an acute episode, you treat, and when that episode is over, they can go home. And so the new facilities would have 120 beds for acute patients, but we don't want people to stay too long in the institutions.
In keeping with modern psychiatry, Dr. Anthony noted that the National Psychiatric Hospital has to be closed.
And so over time, the current facilities that we have in New Amsterdam, we'll be closing those facilities. Those facilities, as some of you might know, was built around 1869. But I think with modern psychiatry, we need to close those facilities. For those patients who don't have anywhere to go, we'll have to find a halfway home for them. And that's something we're looking at right now.
The Suicide Prevention Bill 2022 was approved by the National Assembly in November of last year, decriminalizing attempted suicide and taking a significant step towards addressing mental health. This legislation aims to offer countermeasures to the high rate of suicide that has plagued Guyana's society for a while. Survivors of suicide, people who are contemplating suicide, and people who have lost loved ones to suicide will all receive support as well as programs aimed at preventing suicide. Kerese Gonzales reporting for AGP Nightly News.